Hello everyone, welcome on my YouTube channel. In the previous section, I have discussed about the brachial plexus. What is the brachial plexus? It is the network of nerve fiber, and the brachial plexus has the upper trunk, the middle trunk, and the lower trunk. And today I will discuss about the Erb's paralysis. What is the Erb's paralysis? It is related with the upper trunk. Why? Because here is the injury to the upper trunk. Injury to the upper trunk that causes the Erb's paralysis. And next, what is Erb's point? Erb's point. One region of the upper trunk is called the Erb's point, where the sixth nerve meet here. What are the sixth nerve? Sixth nerve meet here, and upper trunk, one region of the upper trunk is called the Erb's point, or one of the upper trunk of the brachial plexus is called the Erb's point, where the sixth nerve meet here. What are the sixth nerve? First is the C5 and C6 nerve root. Second is the suprascapular nerve. Third is the nerve 2 subclavius and the anterior and posterior division of the upper trunk. These are the 6 points. First is the anterior and posterior division of the upper trunk. Second is the nerve 2 subclavius. Fourth is the suprascapular nerve, and fifth is the C5 and C6 root. Fifth and sixth are the C5 and C6 root. These are the 6 nerve which meet here at the upper trunk of the brachial plexus, and if there is injury in the upper trunk of the brachial plexus, that causes the Erb's paralysis. Now, what is the cause of the injury? What is the cause of the Erb's paralysis? Separation of the undue separation of the head of the humerus from the shoulder joint, from the shoulder, which occurs in the during the birth injury, or fall into the shoulder during the road traffic accident, or during the anesthesia. We do the anesthesia. If there is the frozen shoulder, we give the intra-articular injection in the shoulder joint and fall on the shoulder, or during the birth injury, that causes the Erb's paralysis. That causes the Erb's paralysis. And what are the risk factors that leads to Erb's paralysis? First is the abdominal maternal pelvis. Abnormal maternal pelvis. We know the bony pelvis, and if the shape is abnormal, this is the risk factor. Second is the birth weight, over 8 pound. मैक्रोसोमिया, हेड का साइज बहुत ज़्यादा हो जाता है, एंड बर्थ वेट जो है वह 8 पाउंड से ज़्यादा हो गया. दूसरा सीजेरियन सेक्शन, सी सेक्शन. इफ द cesarean is done, C-section cesarean section. And maternal diabetes, if the mother had diabetes during the pregnancy, and maternal obesity, the mother is very obese, and use of forceps or vacuum delivery. These are the risk factors that leads to Erb's paralysis. The abdominal maternal pelvis, the birth weight over 8 pound, that is macrosomia, the C-section, the maternal diabetes, maternal obesity, and use of forceps or vacuum delivery. And the nerve root mainly involved are the mainly C5 and partially C6. What are the nerve root involved? Mainly the C5 and partially C6. Mainly the C5 and partially C6. And what are the muscle paralyzed? Mainly the biceps brachii. Here is the biceps brachii. Here is the deltoid. Biceps brachii, the deltoid. Brachialis, which is the deeper muscles of the arm, and brachioradialis. These are the muscles mainly paralyzed during the Erb's paralysis. The biceps brachii, the deltoid, the brachialis, which is the deeper muscles, and brachioradialis. And partially supraspinatus and infraspinatus and supinator are also paralyzed. What are the deformity and position of the limb during the Erb's paralysis? We see the patient, when we see the patient, that we see that the arm hangs by the side, and it is adducted and medially rotated. The arm hangs by the side, it is adducted and medially rotated. And the forearm, this is the forearm, it is extended and pronated. The forearm is extended and pronated, not supinated. It is pronated. It is extended and pronated. And deformity is known as policeman tip hand. Why it is extended? Because the flexor muscle is paralyzed. That is the brachioradialis muscle, which are the flexor compartment muscles, which arises from the medial epicondyle of the humerus. And supinator muscle is also paralyzed, so the forearm is pronated and extended. And deformity is known as policeman tip hand or waiter's tip hand. It is also called a policeman tip hand or waiter's tip hand. So the Earth's paralysis, the forearm is extended and pronated, not supinated. In these children, this infant has brachial plexus birth injury and arm is rotated towards the body, that is the medially, and forearm is extended and pronated. The infant cannot move the arm effectively. This is the case of the Erb's paralysis. Now, what are the disability during the Erb's paralysis? The following movements are lost. What are the movement lost? Abduction and lateral rotation of the arm at the shoulder joint are lost. Abduction and lateral rotation of the arm are at the shoulder joint are lost. It means there will be the adduction and medial rotation of the arm. And flexion and supination are lost. Biceps jerks and supinator jerks are lost. And sensation are also lost over a small area over the lower part of the deltoid. Because the deltoid muscle is paralyzed, those also the sensation are also lost over a small area over the lower part of the deltoid. And what are the Erb's palsy sign and symptom? There is the loss of feeling in one arm, loss of sensation, partial or total paralysis of the arm, weakness in the one arm. If the one arm is affected, there will be the weakness in the one arm, numbness and sensation, numbness in the one arm, and limited motion of the arm. There is the arm movement is limited. These are the sign and symptom of the Erb's paralysis. And what are the investigation we do? The CT scan, the MRI, the nerve conduction study, and physical examination of the patient we do for investigation. In the CT scan, we search for damage to the soft tissue such as the brachial plexus. When you do MRI, it takes the images of the internal tissue in the body and to look for brachial plexus nerve damage. Brachial plexus nerve damage can be investigated through the MRI and nerve conduction study. This physical test finds how quickly the electrical impulse from the electrode travel through the brachial plexus nerve. We do the CT scan, we do the MRI, we do the nerve conduction study and physical examination. We look for any physical sign of nerve damage such as muscle weakness and limited ability of the arm, the shoulder, wrist and the hand. These are the physical examination. And what are the treatment? The treatment is the physical therapy that include the exercises, range of motion exercises and sensory activity, in strength training and stretching. These are the physical therapy we do in Erb's paralysis patient. Next is the occupational therapy. What are the therapy? Bathing, brushing their teeth and hair, drawing, dressing, eating and drinking, writing. These are the occupational therapy. And last is the surgery. The surgeon can repair the damage to the brachial plexus nerve and that will not heal on their own, such as when there is the nerve tear. When the nerve cannot heal on, nerve will not heal in their own, then the surgeon can repair the damage to the brachial plexus. This is all about the brachial plexus. The upper trunk of the brachial plexus has been paralyzed, and what is the point? Where the sixth nerve meet here. What are the muscles paralyzed? Mainly the biceps brachii, the deltoid, the brachialis and brachioradialis, and partially supraspinatus and infraspinatus muscles are paralyzed. And policeman tips hand. We see the policeman tips hands, or this deformity is also known as waiter's tip hand or policeman tips hand. This is all about the Erb's paralysis. In the next section, I will discuss the clumpage paralysis. Thank you. Please share, subscribe and like my video.